If there is one thing that can influence people in the wrong way, your body can send you subtle signs that something is wrong. What about those harmless symptoms? It is definitely worth knowing all your indications to avoid severe illnesses in the future. Educating yourself can save you plenty of doctor bills in the future and save a life if deemed threatened. We've paid close attention to a few signs that may help you prevent any unwanted sicknesses, so let's have a closer look. 1. Cracked or dry lips. If you've ever suffered from flaking dry skin, you'll know how annoying and uncomfortable it is. This could be a sign of an allergic reaction to something, so pay close attention to the cosmetics that you're using as well as primary oral hygiene products. Among those on the list are foods and medicines. If the corners of your mouth is cracked, it indicates that you lack vitamins B, A, and E. If you also have dry eyes, a dry mouth, or problems with the digestive system, we'd advise you to visit a doctor because it can be a mixture of symptoms specific for an autoimmune disease called Sjogren's syndrome. 2. Loss of eyebrows. Many of us have this problem, and covering it with makeup can sometimes be a task. It seems that having thick eyebrows are a trend, and apart from that, they're a significant indication to whether you're in good health or not. No one likes walking around without eyebrows, that's for sure. Periodical loss of eyebrow hair may be average, but if you notice an excessive loss of hair as well as bald patches or even complete disappearance of your eyebrows, be sure to contact your doctor as soon as possible. You'd rather be safe than sorry, and this problem can be connected to an extreme or inadequate level of thyroid activity. 3. Nail dystrophy. Nails are in the public eye every day, and we do our best to make them look healthy and sometimes stylish. We are all aware of how healthy nails should look. So, any change in their color or structure is an alarming signal in our levels of health. If the nails appear pale, you could be anemic or have a lack of iron in the body. Yellowing can indicate liver and gastric tract disorders or a fungal infection. White spots and stripes show a lack of zinc, copper, and iodine. They can become very brittle when lacking the necessary vitamins such as calcium, iron, and beta-carotene in the body. 4. Dry heels. This is one of the most common irritations that we have, and when the skin on your feet gets dry, this is an indication that you lack vitamins A and E. It can also be caused by a fungal infection that affects the overall condition of the epidermis. The last case is when there are numerous cracks and yellowing of nail plates. If the dryness and roughness don't disappear, even after proper care and intake of vitamins, this may be a sign of endocrine disruption. 5. Dry skin on the body and hands. Having dry skin is normal due to cold seasons and weather change, but using a moisturizer and drinking plenty of water with vitamins will help this symptom. If these don't work, you are better off having a checkup with your dermatologist because dry skin is also a common sign of diabetes and hypothyroidism. So, if your skin isn't just rough and peeling like the usual symptoms, but also tight and full of cracks, it may turn out to be dermatitis, which is caused by a natural reaction to chemical exposure. So make sure to take note on your intake and daily activities, as well as what elements are surrounding you. 6. Deformities in the feet. When the foot is bent inward and there is a change in the shape, this is defined by the omission of the longitudinal or transverse arches, which usually indicates flat foot. According to statistics, transverse flat foot combined with other deformities occur more often than longitudinal flat foot, and women are more vulnerable to it. Wearing high heels is the primary cause of an uneven load distributed to this place, and it puts the most significant pressure on the area of the transverse arch. So wearing those heels are bad for your feet. When this arch isn't able to stand such a weight, the foot suffers, and you may feel pulling sensations which indicate the beginning of deformation. 7. Teeth stained with white patches. A chronic disease, known as dental fluorosis, develops either before teething or after, when consuming large amounts of water or products with high volumes of fluorine compounds. 5 types of fluorosis are classified and have a few levels. We have questionable, very mild, mild, moderate, and severe. The first 3 variations manifest visually through the appearance of stains. Then, the other 2 are far more severe and indicate decaying teeth tissue and crumbling. This sounds very scary. 8. Loss of hair. This is one thing we all dread, and on average, a person sheds about 100 hairs per day because the follicles go through certain growth stages that can last from 2 to 8 years. When this stage is over, the hair strands fall out, and new ones replace them after a 2-month period. This means that at one point, 80% to 90% of a person's hair is actively growing, while the rest of it sheds or goes through a resting phase. If you've ever noticed a more significant hair loss, then it would be best to consult a doctor because there are a lot of diseases behind this symptom. Some are skin infections, thyroid disorders, autoimmune disorders, just to name a few. It's important to take note of these signals, so you can prevent illnesses in their early stages. So, we hope you found this insightful and we enjoyed sharing it with you. Remember to show this to your friends and family to keep them aware of their health conditions.